Hello and welcome to my video on Loop Diuretics. I hope to provide an overview of this medication class for anyone interested in learning more about them. This class of medication is used quite frequently for long-term conditions as well as short-term ones also. So if you have been on them a while or starting them soon, or just want to learn more about them for your patients, this video should be helpful to you. So loop diuretics are used to get rid of fluid in the body. Obviously the goal here is unwanted fluid that has accumulated in places it should not be. There are basically 4 loop diuretics. 3 are pretty much the only ones used. Of these, torsemide is the only one that does not come as an IV. All the others come in tablets and IV. So while their action is pretty simple, flushing away the fluid, they actually have quite a few applications, the main one being in heart failure, which is a very common health condition. Pretty much everyone with heart failure is going to be on this medication. Now that is not because it saves lives, but because it helps so much with so many of heart failure's symptoms. Another big use, which is pretty obvious when you hear it, is edema, or swelling due to fluid buildup. There are many uses just within this broad category of edema. Many medical conditions lead to repeated or perpetual fluid issues, i.e. heart failure, and others, which result in the need for long-term daily use of these medications. However, there are other cases where short-term someone has swelling issues for one reason or another, and these can be used for a week or so and then stopped, as needed if you will. So they can certainly be customized, as they should, for whatever swelling is going on. You will hear that loop diuretics are good for blood pressure. They aren't. Typically the only decrease seen is short-term, most likely related to water weight, and it is fairly insignificant. You might also hear they are good for blood pressure and kidney disease. Again, not really. The long-term benefits just are not seen as we would hope. Shifting gears to how they work in the body. I don't really think much details are needed in this case, as it tends to just bog down what is happening. Basically, it blocks sodium and chloride from getting back into the kidneys. Now sodium and chloride are what make up salt, and where salt goes, water follows, which results in the fluid not getting pumped back into the body, but encouraged to leave it instead. Throughout this process there are a lot of other electrolytes which are affected that I will go into a little later. Now loop diuretics work so well at getting this water out of the body that the FDA had to put a strong warning with these medications that essentially said, these drugs work really well at getting fluid out, be careful not to get rid of too much. That is why these should always be geared towards the lowest dose possible for the intended effect. With that said, we will start to delve into some of the side effects with these medications. From the top, too much diuresis or fluid output. This also results in orthostatic hypotension, or getting lightheaded when you stand up too quickly. This is because the volume of fluid, or blood, has decreased, and it takes a little longer to get it back up to the brain once you stand. This also relates to why they can worsen renal or kidney function. With the reduced blood flow to the kidneys, it can lead to a higher chance of kidney failure, as well as acute or short-term damage to the kidneys. This seems to be more prevalent when taken through an IV instead of as tablets. Also, taking NSAIDs such as ibuprofen or naproxen further worsen this effect. There are some other less common but potentially serious side effects that can happen as well. They can damage your ears and cause hearing loss. This is typically reversible once stopped, and usually only appears if the doses are started very high and very quick. They can also worsen gout or even cause a gout attack. Also, kind of falling under side effects is how so many electrolytes are affected. The biggest concern is actually potassium. Most people will need to supplement with potassium in one way or another while on a loop diuretic. The other electrolytes can also become an issue, so it is almost necessary to get regular blood work to make sure that everything is keeping to its proper amount in the body. A few other things negatively affected are sugar levels and cholesterol. So again, proper blood work is a must if these are used long term. These can even potentially put you at a higher risk for osteoporosis or weakened bones. So a proper supplement might be needed there as well. Rounding this up with a couple practical facts which might prove beneficial is when these should be taken. In the morning is the best time. No, not because it works better in the morning, but because the water these get out have to go somewhere, and you don't want them going there throughout the whole night. Sometimes people do not get the required effect from these medications and still need more fluid expelling. Combining the loop diuretics with another diuretic called metolazone, or really any thiazide type diuretic, seems to compound the effect and really get that water flowing. Lastly, all of these are interchangeable and have comparison dosing, so it is really easy to switch from one to the other with the conversion factor. Also, the IV and oral dosing is equal for all of them except furosemide, which you half from tablet to IV. So even if you go to the hospital, the dosing will not be an issue. Loop diuretics are very common and very useful medications for countless people. They increase the quality of life tremendously for heart failure patients as well as others with recurring or sudden fluid issues. With that said, I hope this overview of the loop diuretics has benefited you in some way or another. I do release videos fairly regularly on medications and pharmaceuticals, so if you like quick, concise overviews, I hope you subscribe so you can keep benefiting from my videos. Have a good day.